Hi, my name is Wendy McGee, and I live in American Fork, Utah. I have four children and two son-in-laws, and I've been a nurse since December. I graduated from Joyce in December, and currently I am an aesthetic nurse. I work out of my own med spa with a nurse practitioner doing injecting. So I'm primarily doing Botox and learning to do fillers, and I love it. I really wanted to go into aesthetic nursing, and that's why I went back to school. I'm currently obviously working on my BSN and hoping to start the NP program in January. So this is my second career. I was a dental hygienist before this. And I love that. And I just love science. I love education. I love health. I love working with people. And I'm really excited to learn more in this course. I think that community health and public health and just how we as nurses affect those around us for change and how aware we are of what is happening on the local level and in our own, communities is really, really important. I read the article. I thought it was really interesting, talking about what will happen in the next 50 years versus kind of what happened in the last 50 years. I thought it was really awesome how they talked about the gentleman who put together the guidelines for smoking and how many people's lives that has saved. I think that's a very, very, that would have been very difficult probably at the time to do that. And so I think that's really admirable and awesome. I kind of my takeaways from it as I was reading about the different like vaccines and different cures and different things that have come along through the public health and how that is, communicated, I guess, out to the public. I kept thinking about COVID, and I don't know if it's, really okay to say this, but I think that there was a lot of trust lost by the public during COVID, just because of the way that it was communicated. I think that because it was a pandemic and so a very different situation than maybe some of the other things that have been experienced over the years. And because now there have been a lot of things about the vaccines that have been questionable, there are, people that obviously we've become very polarized in just the general public about how people feel about vaccines and how they felt about COVID and everything that happened. I do think some trust was lost in the public health department because of the way things were handled politically and also maybe just decisions that were made and information that was given to the public prematurely. It was interesting to be going through nursing school at that time and to hear how different professors felt about it, how different nurses that we worked with in our clinicals felt about it, different doctors. But I think going forward, the thing that I would say is just that trust has to be reestablished on the local level. It has to be reestablished between nurses and patients individually, with communication and conversations and education so that the public does trust that, the healthcare profession is looking out for them and that we are doing everything we can to, educate them, but also to immunize them correctly, to give them the very best, medications, cures, education, to help them. But I do think that that is definitely a bigger problem than it maybe was. But I thought it was really interesting to read about the amazing successes that had happened over the years. And it was also interesting to see how that had affected like the jobs and how many people lost their jobs in the healthcare field and just some of those things. So I thought it was a really interesting article. I think it is kind of a difficult subject to talk about briefly because it encompasses, a lot of different like feelings and opinions and aspects and things like that. I think me being older, I probably have a different view of it because I've kind of lived through, you know, like growing up, always really trusting public health, trusting vaccines, getting vaccinated, understanding and feeling like that the public health system was always on our side and looking out for us. And then, going through the last few years, having it be kind of a little different with the political narrative and all of that. So anyway, I'm excited for this course. I'm excited to learn more about public health and to understand more about how I can be an asset in the community, how I can help instill trust in my patients in the healthcare system. So yeah, I'm excited for the course.